Warm welcome to all of you. I want to start by congratulating the 3 editors of the book that is launched today. I checked yesterday evening. The volume was already downloaded more than 100,000 times in the first 4 weeks since it was placed on the internet. So apparently the message has gone around and is going around. That is a piece of success. Colleagues, we discussed today how planetary health and people's health on the planet can be improved and actually rescued. Our challenges are bending the curve of greenhouse gas emissions and air pollution, and bending the curve of COVID-19 infections. And if we do not bend some other curves, such as the one of hunger and biodiversity destruction, planetary health will deteriorate and collapse. It's this larger context that we need to address. Colleagues, the book draws on a conference and research done thereafter. It proposes 12 solutions. 12 solutions. I just mentioned 2. Number 1, health must be central to policies that stabilize climate change below dangerous levels. Another conclusion is the rich should not only expeditiously shift to save energy and land use practices, but also provide funding to the poor for the costs of adapting to climate change. Let me leave it at that with my introductory remarks. I call now on His Eminence Cardinal Peter Turkson. Your Eminence, we are particularly grateful that you address this conference, also in view of your leadership in the commission of the dicasteries and other organizations to address the COVID-19 pandemic. Your Eminence, you have the floor. Please limit your comments to 15 minutes.
Thank you. I hope I came in loud and clear. So thanks for the invitation and congratulations on the production of this book. Call to just say a few words by way of opening and introducing the discussion this afternoon. I'd just like to observe the relationship between the health of the planet and the health of people, of human beings on the planet. And I'd like to observe, we start off by referring to the fact that in 2014, when the Holy Father visited Korea, then on his way back, he had an interview in flight and then revealed for the first time his intention, his plan to produce a book on ecology, and mentioned that he was doing that with the help of the dicastery. With that revelation, we received a visit. The first visit in response to that revelation was from 2 medical doctors, one from Boston, the other one from Italy. The 2 doctors were friends, and on hearing that there was a project about producing a book on ecology, they came and wanted to ensure that the issue of healthcare was not left out, or the production or the project did not miss out on healthcare. So the big emphasis for them was to recognize the role of healthcare when you talk about ecology or the environment. And this brings us probably also to the central theme of the Pope's encyclical itself. Central theme was integral ecology. Integral ecology brings a lot of things together, which Pope Francis himself several times refers to as, everything is interconnected, everything is interrelated. But it is this also, which also introduces us, I suppose, to the book that we're about to discuss and talk about. Because integral ecology refers to the fact not just of everything being interrelated and connected, but the fact that When Pope Paul VI in Populorum Progressio first invited us to take care of the environment, of nature, so natural ecology, this was quickly followed by Pope John Paul II, who said that it's not only nature that has an ecology or environment to be taken care of, but the human person also has an environment to be taken care of, a human ecology. We went on further with the pontificate of Pope Benedict XVI to extend this and take this one step further and talk about social ecology, that society itself also requires a certain a certain number of conditions to prevail to make it succeed, and added also an ecology of peace. So between the pontificates of Pope Paul VI and that of Benedict, we've had popes come and describe ecology of nature, ecology of the human person, human ecology, ecology of society, and ecology of peace. When you put them all together, then you have this integral ecology, which means that there's no way one can carry on a conversation about ecology of nature, care for nature, without being concerned about care for the human person and society. And that's how the two of them belong together. And so the healthcare or the well-being of the earth naturally is related to the well-being of the human person. And the topic of the book which you've developed, health of people, health of the planet, and our responsibility, is all keyed in this sense of integral ecology, to see how concern for the well-being, environmental well-being of nature is related with the environmental well-being of the human person. They go very close together. It's not my turn to describe the details, but otherwise, depletion of the environment affects the health of the people who live on the environment. It's just been observed that agricultural concern and food production and all of that are also very closely related with the health, well-being of the environment. And just a few days ago, when, as a result of the COVID, cars and traffic were kind of grounded in New Delhi, it was possible for people to see the Himalayas and the ice cap on the Himalayas. An asthmatic patient interviewed in China said that he was glad that he could come out and now breathe properly as an asthma patient. So the relationship between the well-being of the planet and that of the human person cannot be gainsaid. And having now to discuss this is a very apt issue, especially in this closing days of this period of the COVID. The relationship between the well-being of the earth and the planet. Now, a sense of responsibility, however, and undergirds all of this, because the beginning point of the relationship between the well-being of the planet and of the human person, they're all grounded in, according to the biblical tradition, in the event of creation. But there, creation entrusted into the hands of the human person was done with the expression to till and to keep. And that just means that we may not till too much and keep too little, but we must keep as much as we till. And the sense of keeping is what I like to observe a little bit by way of kind of concluding my small introductory remarks. The Hebrew expression which is used here in the Old Testament, asking the human person to keep their garden or the garden home that God has prepared and created for it, is the same word which is used about the relationship between brothers. When, for example, Cain killed Abel, and God asked Cain, where is your brother? Cain's response was, am I my brother's keeper? The same verb, lishmol, which was used about Cain's responsibility towards his brother whom he had killed, is the same word which was used by God to entrust the garden into the care of the human person, to keep, lishmol. Therefore, the relationship between the human person and his garden home, the environment, creation, is presented in kinship terms, as if human beings are related, the earth exists as a kin. in the kinship term to the human person. This, of course, we know will be amply developed by St. Francis of Assisi, who refers to all elements of nature in terms of a brother, a sister, a mother, and all of that. So the invitation then, which describes our responsibility, is the relationship of needing to keep the earth as if it was a kin, as if it was a member of the human family. And this is what the encyclical Laudato Si underpins. So Pope Francis in the encyclical Laudato Si invites us to consider ourselves as human beings, not as the autoreferential center of creation, making use of everything at will, but to consider ourselves as part of the created system. We belong to the created structure because our bodies are drawn from the material of the earth and our lives are sustained by the product of the earth. So we're so very much a part of the created, entity or created reality that we cannot just abuse it or use it as we please. So our sense of responsibility is then related in this. And in this regard, Laudato Si does not so much talk about stewardship towards creation. It uses the more emotional, if you want, expression, care for creation. Stewardship is used only twice in this encyclical. Every other way that the Pope presents and talks about the relationship between the human person and creation of the earth is in terms of care. Care as if it's a passionate relationship that we have towards creation and the earth. And that describes the sense of the type of responsibility that we need to show. It's as if we're keeping a brother. It's as if we show care and responsibility for a brother or a sister or something or somebody we related with, so intimately and personally. And so, bringing my small comments to a close, we were just invited at the beginning so others can speak. I simply just want to relate and to root the discussion, health of the people, health of the planet, in this sense of integral ecology, natural ecology being as valid as human ecology, and the impossibility of describing one without the other. So our conversation about nature implies our conversation about the human person. So Pope Benedict, for example, would have said that we're not dealing with two books of nature, it's only one single book. And Pope Francis would say that we're not dealing with two crises, we're dealing with a single crisis. And invite us to listen to the cry of the poor as much as we listen to the cry of the earth. So it is the relationship, the relatedness of this in integral ecology that I like to draw attention to and refer to the biblical expression of keeping as a basis and a form of the responsibility that we need to exercise towards all of creation. And with this, again, I want to conclude and thank you for having invited me to keynote this conversation. Thank you.
Thank you so much, Your Eminence, for introducing the integral ecology concept and the need to achieve it, to pursue it with responsibility as keepers. You were briefly introducing, so let me call on Governor Brown without having alerted you beforehand. I'm sure you listened carefully to the Cardinal. Do you have a 1-minute reaction at this point?
Yes. The fundamental point of relatedness, that's what's missing as I see it, speaking from the political sphere. The nationalisms, the collective egotisms that we see in the world today, the thrust, whether it's by the United States or by China or by Russia or by many of the other countries, is missing the point that we are mutually vulnerable. We all are subject to the plague. We're subject to the mistake and the pain of some nuclear blunder that could easily happen, or to climate change, or to the COVID, or to other diseases, or to the scourge of poverty. So what's needed today in politics is a transcendence of the low state of public affairs, rhetoric, and consciousness. So I would hope that the integral ecology, which is spoken at a theological level, can somehow be translated to the mundane political give and take, which constitutes the essence of politics.
Thanks.
Thank you very much. And Eminent Cardinal Turkson, thank you again for your marvelous introductions. I hope you can join us for a little longer.
Sure.
I'd like now to turn to the three editors. Our esteemed Chancellor Marcelo Sánchez Sorondo. Marcelo, you have the floor.
Yeah, I think that this book is prophetic book. I use this theological word, but because anticipate times, in the sense that the ideas, the message of the book is to say that we are not responsibility in our steward, say the cardinal, with our habitat. The habitat come back again to us in the end. And we don't know what could be this kind of reaction. Well, we know somewhat of the reaction, but also we don't know what could be the reaction of the animals or the virus and all those things. So the relation between the climate and the human being is absolutely. And I want to remark that what is the reason that as religious, the Pope, the Magisterium of the Pope, the last Pope, as said the Cardinal, are interested in this question, because many people can say, but this is not the subject of the Magisterium of the Pope. But in the contrary, in the idea of the last Pope, but especially Pope Francis, we need to defend our habitats because it's in some sense part of our life, our life of human. And we need to be together to defend this. All the religious people that consider that human beings are in some sense image of God, and the habitat is part of the life of the human being. So in this question, in relation to the human dignity and in relation to the planet, we need all work together, all the religious people and all the leaders of religion. And this was the message also of this meeting, and also was the message of the first meeting that we have with Pope Francis here, with all the religious leaders, that the Pope say this message. So for this reason, I think this book that also put together religious leaders to consider the problem of our responsibility with the planet and of the health of the people is very important and is prophetic. Because if for the first time, I think, we put this connection between the people and the climate, and the health of the people and the climate. And I want to add something that is implicit in the consideration of the cardinal. What is important of science in the end? And what is important to have an Academy of Science for the Pope? Because it's clear that to be steward of the creation comes from the Bible. But to understand what is the situation of the planet, we need science. So we need to put together science and religion, faith and reason, and this is our task. And this is for the first time made in this book. So for this, all this reason, I consider that this book is a beginning of many others that we need to go in this life. Thank you very much.
Thank you. Thank you very much. Let me turn to you, Ramanathan. Professor Ramanathan is a professor of atmospheric and climate science at the University of California, San Diego, and an academician of PAS. He is one of the spiritus rectors for this whole book and research track, which brings us together today. Ram, you have the floor.
Thank you, Joachim, for the generous introduction. Good morning and good afternoon, friends. First of all, the book is available in hard copy too, in case you want to buy it. And the world now, as we know, is in the midst of a public health crisis due to the pandemic. The pandemic inadvertently has made us all aware of a dominant issue of our time, which is social justice, including racial justice. Social justice is also a major issue for climate change. So let me give you just one example. More than 50% of the climate pollution is from the richest 1 billion people. The poorest 3 billion, whose contribution to the pollution is barely 5%, are going to suffer the most. Laudato Si, as His Eminence Cardinal Turkson and Chancellor Marcelo already said, was prophetic about social justice. Pope Francis said in his encyclical, we are faced not with two separate crises, one environmental and the other social, but rather with one complex crisis, which is both social and environmental. Basically, environmental and social problems are inextricably linked. I became aware and educated on the social justice issue because of my affiliation with PASS, Pontifical Academy of Science, beginning 15 years ago. And it brought me to work with experts like Fauna Farman on social justice, and my two daughters, Tara and Nithya, who are working on providing clean cooking. All of these are authors of the book. Our book, thanks to a stellar group of authors, discusses not only the social and environmental crisis, it does a deep dive into the interconnectedness of the social and environmental problems. The book begins with a declaration which summarizes the problem and lists 12 solutions. I'm going to summarize the entire book in 2 sentences just from this declaration. The first, with unchecked air pollution and climate change, the very fabric of life includes human health is a grave risk. The solution requires a societal transformation. That transformation has to enable a fundamental change in our attitude towards nature and towards each other as human beings. The book proposes 12 solutions, as our President Wellcome said. Let me read the 12th solution. It says, promote an alliance of scientists, policymakers, political leaders, healthcare providers, faith and spiritual leaders, communities and foundations to foster the societal transformation. In fact, the authors of the book and this gathering consists of such an alliance. The book was almost 8 years in the making, and under Pope Benedict, we at the Pontifical Academy of Science organized a workshop on mountain glaciers. This then led to a historic meeting in 2014, organized jointly by Pontifical Academy of Science and Pontifical Academy of Social Science, now under Pope Francis, and that meeting was Sustainable Humanity, Sustainable Nature, Our Responsibility. About a year after the publication of that book from this 2014 meeting, our academy got interested on the health effects of climate change. And in part because of numerous studies organized by WHO, we have the leader here, Maria Neira, and the Lancet Commission. Andy Haynes, I think, is part of the authorship. He was responsible for some of that. But there was also one major development in climate science which linked climate change intricately with health. That is the fact that meteorologists were coming to the conclusion that most of the extremes we experience, heat waves, droughts, floods, fires, were because the planet was warming. And these extremes over the last 20 years had caused 600,000 deaths and displaced 4 billion people. So clearly there was a compelling reason. So Chancellor Marcelo, Professor Dasgupta from Pontifical Academy of Social Science, and myself, we organized this meeting in 2017. The title of that meeting was Health of People, Health of Planet, Our Responsibility. The invited speakers at that meeting are the authors of the book. The papers presented essentially became chapters of the book. The uniqueness of the book is that it discusses climate change and air pollution in the larger context. And it starts off with the foreword and the Anthropocene. And the first set of chapters discuss the following topics: evolution of living organisms and their dependence on the environment, biodiversity and the ongoing march towards biological extinction, models of economic growth, linkages between human health and planetary health, and so on and so forth. The book then does a deep dive into the nature, scale, and magnitude of air pollution and health effects. It talks about also food and water security. The one that caught my attention is the mental health impacts. So to quote the lead author, Lisa Van Susteren, it says the psychological impacts of global overheating will carry the biggest burden and be the most difficult to remedy. Imagine that, mental disease. So several chapters focus on vulnerable populations, social justice, possible mass migration. The book also gives a list of host of solutions, which include all the traditional solutions: decarbonization, cuts to superpollutants, extracting the carbon. I want to highlight here two of the most urgently needed solutions from my perspective. The first, we have to provide clean cooking and clean heating solutions to the poorest 3 billion people whom we have left still to rely on primitive 19th century technologies. They just can't cope to climate change when it hits us soon. In the developed nations, in the US, particularly roughly 68% of African Americans live within 30 miles of coal-fired power plants, likewise with other polluting industries. We need to accelerate efforts for clean air, clean soil, and clean water for these disadvantaged communities. They number in millions. So I want to conclude with the last part, my most favorite part, written by faith leaders, policymakers, and healthcare professionals. So I'm going to quote three. Reverend Leith Anderson writes, humans are responsible to God for the preservation, protection, and thriving of all God has created, including the air, land, water. Reverend Mitch Hescox, CEO of the Evangelical Network, says climate change is the greatest moral challenge of our generation. So puts it in moral terms. And Bishop Alistair Redfern, he writes, the potential power of mobilizing believers and faith communities to practice and support appropriate action for climate change and proper approaches to health is enormous. I think this is what our community has to use, go into alliance with faith leaders to get the type of public support we need. The whole spirit of the Academy effort is captured in chapter 29 by our California Governor Jerry Brown, who's here. He writes, so the power here is prophecy. The power here is faith. And that is what PAS, Pontifical Academy of Science, is all about. So let us be about it. The it is the technical, the scientific, the political, but never let us forget our challenge is transformation. Transformation in the profoundest way possible. We agree with you, Governor Brown. So just in a few minutes to conclude, I think of COVID-19 is the dress rehearsal for what we are likely to face with climate change in about 10 years. When we think of climate change, we are thinking 30, 40 years. I want to remind you, the crisis is going to start in 10 years. That's when the planetary warming is likely to exceed a degree and a half. That's 50% amplification of the warming we have experienced so far. So what it implies is that likely the weather extremes, such as heat waves, droughts, storms, and floods, could also increase by 50%. What does that mean? Climate change will move into everyone's living room, like what COVID-19 has done to all of us. It's in my living room all the time. As we are learning from this dress rehearsal, solutions to climate change will require global collaboration and generous sharing of scientific knowledge and technological measures across national, cultural, ethnic, and racial borders. The sort of alliance the Pontifical Academy formed in bringing out this book will help enable such collaborations. Lastly, just 30 seconds, I want to thank UC University of California, Institute of Public Health, World Health Organization, Miragla Foundation, University of Bonn, and Max Planck Institute for financial support to the Pontifical Academy event and the book that resulted from it. Thank you, Joachim.
Thank you, Ram. Thank you for your speech and for your leadership. Our next speaker is Professor Al-Delaimy at University of California, San Diego. He is an epidemiologist with a medical background. Wael, you have the floor.
Thank you. Thank you, everyone, and for giving me this opportunity. And I have the task of trying to summarize the 400 pages book in about 5 minutes. So let's see if we can do that. Basically, this background of the book is becoming, it's becoming a benchmark. It's really an amazing work that has everyone has something for everyone in society. I checked last night, it was 103,000 downloads, and just now in a few hours after, it's 105,000, so it's increasing. And I checked with the publisher, and this is a record for this book, because the average of downloads from environmental books from Springer Nature is 26,000, and 26,000 over the life of a book, while this is only now 1 month and it is already 105,000. So clearly we have put something that is of interest, and as Chancellor Marcelo said, is prophetic. The book, as described, has all people from different backgrounds: psychologists, physicians, healthcare providers, and climate scientists, faith leaders, health scientists, air pollution scientists, politicians, biologists, and so on and so forth. And that's really what makes it unique. And that's why we have this interest, and so many people are interested in it. But the main thing that we wanted to do is have health as the focus throughout, because there are many other books out there that discuss this in a way that doesn't include health. So, so as this figure, which is kind of already summarized by Ram about the content, but I wanted to put it in a visual. I'm a visual person, and so I like to do that. But the central theme of the book is the human health, and I put the content and the chapters and the authors because I don't have time to acknowledge all the illustrious authors and contributors, but you can see it on the upper left corner are the titles. So with the first section, we begin with the things that are related to our environment, the planet, the ecology, living organisms, and species extinction, and how that will impact the human health, as well as the economy and wealth, and how we have to take in consideration a different perspective of wealth, and take in consideration the tax on the planet and how that can impact the health for the generations to come. Then that section goes into the climate and air pollution as the key factors that are impacting the human health in the view of the Anthropocene and the planetary health. So that gives the kind of intro and the connection to the planet. Then we shift into air pollution as a focus in terms of its burden, the mechanisms that are causing the health impact, the environmental policy context, as well as how we can reverse them through the policies and through the burden of the mortality reduction. Then we go into a vulnerable population, and the Middle East and North Africa is going to be the epicenter of the health impacts of this climate change. And it has a lot of contributing factors in addition to political instability in terms of scarcity of water and the heat. And so in that same section, we have a very important aspects of water scarcity means hunger. And that also is related to agricultural practice and food insecurity and how that can impact the health, as well as the connection between the Amazon forests and the wildfires in relation to air pollution. They all link back to human health. So that gives the perspective of the different aspects that are related to human health out there. Then we go and get this unique perspective from physicians. We're going to hear later on today from that, and it's already been discussed, but the physicians' perspective on climate change is rather new and not included in previous books. And then the most relevant today is social justice, and this is discussed in terms of the immigration and in terms of examples from low-resource Latin America, where these success stories of climate solutions and social justice all improving human health. And it's very relevant today in the protests that are going around the world and how that also impacts and related to climate. And of course, another component of human health is the faith. And that's where we have the faith leaders discuss how the climate and health aspect is part of the Holy Scripture. It's part of the morals and the ethics, that it is a requirement. And they also provide examples of how to do it. So all this book has actions. It's not just theory. That's what's unique also about the book. And those are the issues there. And then we shift into the solutions. And these solutions are many, as you saw in the upper corner, but it includes mini grids and energy alternatives, using sensors and technology to try and limit the exposure of people to harmful biomass fuel, and how mitigation and co-benefits will help focus the health co-benefits of mitigation, as well as policies. And then we're going to hear later on from Jeremy Farrar about how non-governmental organizations can take high-risk interventions. And then finally, we have the examples from Governor Brown and how state standards led to saving lives and led to the change at the national level by this leadership of one state. The politics of engaging societies are discussed by Congressman Peters, and that we need to engage new stakeholders, as well as the Sustainable Developmental Goals by Sachs, describing the context in a perspective of sustainability, and finally how healthcare providers can be and must be advocates for all of this. So this is giving you the sense of what the book looks like, and you are welcome to go read it further. I want to say that we are planning for the next steps. There were discussions of what is next, and that is going to be, that's something that myself, Fona, Foreman, as well as Ram, are planning a virtual meeting that in November. And the aim is that we take this book and the actions and implement it into policies. These implementations leading to change in behavior and impacting the short-term and long-term health outcomes, as well as using the momentum that is happening in society to make all these happen through organized actions, education, and grassroots efforts, and to eventually change the social norm. So we want this book to be a reference and a benchmark for this effort, so that it doesn't stay in the shelves or as a theory, but actually become alive and actionable. And the initiative we named is Protection of Public Health from Climate. You'll hear more about this, and you will be all invited to this. So in summary of the health effects that many of you are aware of, but we are having an increase in heat waves, almost 300% increase in deaths from heat waves around the world, and almost 3.5 billion will be exposed or impacted by that. The human habitability is going to be compromised in many countries that people cannot be outside for most of the year. The spread of diseases because of insects that thrive in warmer temperature, and the wildfires, the drought, that has increased almost 1,000%, as well as the hurricanes and flooding, and the 7 million deaths per year attributed to indoor air pollution. All these are serious aspects that we need to kind of prepare for. What we learned from COVID-19 is that COVID-19 united us as a global community. It is when those people who realized that we're all in this together, that no one is immune. And we saw there is an unprecedented level of cooperation across regions and countries. And that is because it's about health. It's about life and death. It's not about just the environment. And that's where we think people can maybe listen and change their perspective about climate change. The other aspect of injustice towards vulnerable populations, and here in the US, we saw the tragic death of a vulnerable population represented by George Floyd, and that created a movement against injustice. United people and humans about the compassion and the feel, the suffering, not just for people in the US, but all around the world. And these are the same people who are going to breathe the polluted air. We're going to suffer from the heat waves, and will lose the most from income as a result of climate change. So we have a moment in history to make this difference, because both the COVID-19 and the injustices are all targets of climate change that we will, we can impact by taking this advantage of this to focus people about the climate change is going to be much, much more than COVID-19. The injustice is not going to be just for the minority and the vulnerable, but everybody will be affected. And with that, I close. Thank you.
Thank you. Thank you so much, Wael, for this skillful synthesis of the book in literally 5-6 minutes. That was brilliant. This graph has helped all of us remember how we got to the synthesis. Let me, before moving on, turn to you, Jeffrey Sachs. Jeff, you will recall that we were sitting with Ram and Wael and a few others until long after midnight to identify the 10, in the end it was 12 main conclusions of this book, and you played an instrumental role in that deliberations. Jeff, do you have a 1 or 2 minute reflection on what needs to be done from here on?
Thank you very much, and it's good to be with everybody, and I hope everybody is staying well and safe. The urgency and troubles of our planet are even much greater than we might have imagined a couple of years ago. And this virus itself, a reflection of human interactions with nature, is a dramatic reminder of that, and a very dramatic reminder of how difficult it is in our current institutional arrangements, our current politics, to find adequate solutions. We have almost 500,000 deaths worldwide from COVID right now. And in many countries, including my own, sad to say, absolutely no common spirit, approach, problem solving, or even ideology of life that moves us in the right direction. United States, under very false understandings, misunderstandings, and moral misunderstandings, pitted this virus as a case of economy versus life. And we had evangelical preachers saying that it's the duty of the old people to die, to save the economy for young people. Nothing less than that. It's quite shocking what happens when a society falls apart, which is what has happened in the United States. But it's happened in Brazil. It's happening in many countries around the world right now. So I think the work that we have been doing together to combine basic moral discussion with basic practical science is essential and very much desperately needed, because we lack even the insight right now to stay alive. It's not even America first, as nasty and stupid as that is. It's not even America anywhere, because we're falling apart. So I want to thank the editors for this volume and to emphasize how much basic work we have to do, even helping other faiths understand better that it's not a matter of life versus economy or climate versus economy. We will have neither our nature nor ourselves if we don't understand the integral connections, both in a physical sense and in a moral sense. And that's why the merger of these efforts, the moral guidance, the philosophical and theological guidance, and the scientific leadership is so essential to combine. So thank you very, very much, and congratulations on this volume.
Thank you. Let's get back into our planned program. We are still good on schedule. Thank you to our speakers. Our next speaker is Maria Naira, a Spanish physician who serves as the Director of Public Health, Environment, and Social Determinants of Health at the World Health Organization. Our Pontifical Academy is very much in support of WHO. Maria, you have the floor.
Thank you very much, and thanks for these nice words to support WHO. We are really very happy, and coming from the Vatican group, it has even a stronger meaning for us. It's as a kind of blessing, which is even more valuable. I'm very happy to be with all of you and to see you healthy and still full of energy and committed to what we have in front of us, which is really very, very challenging. I would like to congratulate all of you for this achievement resulting from this very pleasant and strategic meeting in Rome. I think we all remember and keep very precious souvenirs of that meeting, the richness of the intellectual power convened there and the good spirit on proposing something that hopefully will have a positive impact on humanity. I would like to congratulate the editor for the work, but not only for on his visual presentation, putting human health at the center. I think this is the most powerful argument we have. That was discussed very much in Rome. We all agreed that if we use the health argument, that can be a very strong argument. This can be an incredible motivation to the people we want to mobilize, and it's something that will keep the momentum and give a very good emphasis to those who think that what we are talking here about that is just about protecting the planet or protecting the environment. Well, no, it's about protecting human health. And I think COVID-19, what a shock, what a earthquake that has been moving all of us. It proved that we have very strong weaknesses. We have weaknesses in terms of how we are prepared for responding to epidemics of infectious diseases. Something went wrong on that. But something went wrong as well in terms of access to universal health coverage. Again, one of the things that for health is fundamental it has proved that there are still a lot of differences among our population, inequities. Those who are lucky that live in countries where they have free access to universal health coverage, and they can be sure that they can be treated and receive the best of what a society can offer to them. But in many other countries, this has been, again, a demonstration of the incredible inequities in terms of social and economic capacity, and how many citizens are still very, very little protected by all of us, and hopefully we will change that. And I think the third weaknesses that the COVID-19 has obviously demonstrated is the issue of the bad relationship we have with nature, with the ecosystems, with what is the source of human health, and how bad we are in terms of pollution, in terms of all of those environmental determinants of health, how much we are vulnerable, because most of those pandemics, most of them, more than 60% of them are zoonotic origin, and therefore if we don't have a better interaction with human health, animal health, and our ecosystems, nature's health, we will not get the benefits that we are now extracting on such an aggressive way from the nature. So, in all of that, the world decided to go into a confinement. The planet decided to stop economic activities. At one point, more than the half of the planet was on a massive lockdown, with all the economic and social consequences that this is having and will have, which will be dramatic. And all of this was done in the name of health, in the name of human health, because no politician will be able to propose any lockdown if he was not convinced that the citizens, the population was behind that measure. It was almost a popular pressure telling us you need to do something exceptional, you need to do something dramatic, and you need to, even if it's at the price of paralyzing the economy. So it's an incredible lesson, and it tells us something that we knew, but probably we were not understanding enough, that when people feel vulnerable, when they feel that their health is at risk, they can really move on a very strong way. So what now? Now, everybody, we need to take our citizens out of this terrible situation. Then we need to ensure that there will be a recovery, there will be a healthy and green recovery if possible. We need to take advantage of what the people, when during their confinement, what they saw in terms of clean air, in terms of blue sky, in terms of clean water in the cities, less noise, the city able for you to circulate and be the center of the city, the humans again. They saw that and they love it. although nobody wanted the lockdown, of course, but there were some glimpses of what it could be the future if you do the things right and if you have access to clean energy and you reduce consumption and you reduce traffic, you could see a lot of benefits. And more than anything, we don't want to go back to the pollution levels that we were before that. The question now is, how do we do it? Because the last thing that our population needs, that our citizens need, the international and global citizens in our societies need, is yet bad news again. So you are still trying to recover from this terrible, dramatic health crisis or political crisis and economic crisis and social crisis. And be prepared, because this is nothing compared with climate change and air pollution and all of these terrible crises that are coming will be much more dramatic than COVID-19. So we need to use, we have the responsibility to use a narrative that will be very positive, will be very engaging, will be very inspiring in terms of telling the citizens, we are taking you out of this crisis. We will be together going to a recovery and a healthy and green recovery. And at the same time, this will be the best way to protect your health. So the language more than ever that we need to use now for climate change is saying, if you want to reduce vulnerability to your own health, if we want to make sure that we will protect health, we will promote health, and we will make you less vulnerable, the best way to do it, or one of the ways to do it, will be to tackle the causes of climate change, because the causes of climate change will be terrible for human health for the reasons we saw before and for all of those very strong arguments for which we have an incredible amount of scientific evidence. The moment the economy is trying to recover, we saw already the levels of pollution going up. And that's why in WHO, allow me just 3 seconds to introduce what we call it a manifesto for a healthy and green recovery, where we are proposing 6 prescriptions, health prescriptions. The first health prescription is about recover your relationship with nature. Make sure that you protect nature, because that will be your first green wall to protect your health. Make sure that you have a better interaction with your ecosystems and with nature. That is the one that will be the main source of human health. Second, provide basic services to your population, access to safe water and energy, and then the basic services that other ways there is no pandemic, epidemic outbreak that will be protected from, because if you don't have the basic services, you will be extremely vulnerable. Number 3 will be make sure that you use modern energies, make sure that you use clean energy, send back the fossil fuels to the place where they should be, and make sure that you stop and you contribute to stop of this horrible pollution that is responsible for 7 million deaths every year. 4, sustainable food systems from the beginning to the end. 5, livable cities, places where we can walk, where we can breathe clean air, where we can have a sustainable public transport system. And 6, stop paying subsidies for fossil fuels. This is a very political thing, but WHO has very openly endorsed that. Stop subsidizing fossil fuels that are killing us. And with that, and again, congratulating all of you and thanking you for this opportunity to present here. Over to you. Thank you very much.
Thank you very much, Maria. These 6 points are pretty much in integral ecology, as introduced by the Cardinal earlier. Our next speaker is Sir Jeremy Farrar, Director of Wellcome Trust. He was previously a professor of tropical medicine at University of Oxford. Jeremy, you have the floor.
Thanks very much, and it's a great pleasure to be back with you again. It seems a long time ago that we were together at the Vatican, and the last few months have been very difficult for everybody in the world, and pay tribute to the role of WHO, Maria, in what WHO has done in this, and tried to bring the world together despite a lot of great tensions. But I'm sure I speak for everybody in offering you all of the support from all of us on this line and beyond in very difficult times. And how the world has changed over the last few months. Who would have thought, even in November and December of last year, that the world would go through already now 6 months of a quite remarkable, truly unprecedented in anybody's living lifetime, of such something that has affected the whole world within about 120 days of the emergence of a new issue. And we have a very long way to go yet. Speaking now from an infectious disease background, this infection is now with us to stay. It is not suddenly going to come to an end. This is not SARS-1, this is SARS-2, and SARS-2 is a very different infection and will not be disappearing anytime soon. And of course, as others have said, and it's difficult to not pull out lessons from the current crisis, because I think some of them are very relevant to the issue of the climate change that we face during the 21st century. At the heart of the COVID pandemic has been a changing relationship between mankind and the planet. In this case, with ecology, changing environments, changing relationships between humans and animals, changing patterns of behavior of those animals, and of course, mass urbanization and connectivity. But also of an inequality. As Wael said earlier, yes, we have been all in this together, and there have been some positive signs of people working together around the world, and as I say, pay tribute to the WHO in trying to bring us together. But the truth is, this doesn't affect everybody equally. It does affect marginalized people, it does affect people in informal camps, it does affect people of different ethnic groups differently. And it doesn't affect everyone equally, as no crisis ever does. And the most vulnerable and the most marginalized in society have been the most affected. And that will be true of the crisis that we're likely to face in the 21st century. The way coming from an emerging infectious disease background in my own professional career, I've always framed these in 4 overlapping circles, which I think are also very relevant, directly analogous to the ones we face with climate change. In the first circle at the middle is the direct health impact of the infection, or indeed of climate change, of COVID-19 or climate change. The next circle is the indirect consequences, not directly related to the infection, but the fact that with the pandemic, you cannot access normal healthcare. You cannot get access to maternal child health, vaccinations, tuberculosis control, or indeed cancer therapy or diabetic therapy. So there is a very, very significant impact on the rest of health, as there will be with climate change. The third one, though, in some ways is the most troubling. And Jeff Sachs mentioned this in some ways, but just to build further on that, and that is the impact on society as a whole. Yes, on economies and on the generation of wealth and the sharing of that wealth, but also trust between the governed and the governing. When societies are put under this level of stress, there are questions raised between the way that countries are governed, the way that societies has respect for and is willing to follow the governments of the day. It also raises the fault lines that are existing in society anyway. The fragmented societies, a lid is lifted on them, and the tensions which we often do cover up and don't wish to talk about are exposed in ways that they wouldn't otherwise necessarily be. And of course, the inequalities of the impact. So that crisis breeds fear, and it then feeds into politics. And the fourth circle is those international relations and international politics. And some of the language of the last 6 months of calling it this virus or that virus, putting one country before another, and the rising concerns of vaccine nationalism, where one country may put its own citizens first above all else and not be willing to share what is a global public good, I think is of real concern, as well as the pressure on international agencies, including the WHO, as a result of the geopolitics of our time. And climate change and health will have similar impacts. On climate change and health, I think for me, the strongest element of this book and most critical of all was that we have, as I said, at the Vatican, often portrayed climate change as something which will happen gradually over the coming decades. I think the key message of this book is that actually it's here now. It is not something to talk about in a decade's time or 2 decades' time, because there has to be the urgency of now, as we see, whether it be through COVID and the emergence of new infections, or whether it be on the direct impacts of climate itself. And that is going to need the whole of society. And as we come through COVID and we start to think about how we're going to deal with the greatest challenge of the 21st century, which is the one we're discussing today, as we come out of the COVID crisis, we will face a choice, as humanity has always faced a choice when it comes out of such crises. And the choices will be whether we revert to a more polarized world, of choices between this or that polarized world, or we retreat to nationalism and insularity, and we look after ourselves and look after people that look like ourselves? Or are we going to take a different path? Are we going to move to a more multilateral world where actually the common public good and the protection of all of us, wherever we live and whatever our income, is at the heart of the future? And we will face such a choice. And with the geopolitics and tensions of the moment, and exaggerated through the COVID crisis, at the moment, I would be very concerned that we may choose the more nationalistic approach, as we did at one point in the 20th century, and that clearly led on to crisis just a few years later in the middle of the 20th century. And our generation and all of those around at the moment will be leaders in deciding which of those choices we face. And so the lessons for me of COVID is almost a harbinger of what is going to come with climate change. And we will face those choices. And this book is, I think, an attempt to put out there that A, it's not going to wait 10 years, and that B, if we don't work on this together with a sense of common purpose and common good, then we will go back to a more nationalistic world, which I think would be very dangerous. So as we learn those lessons, I think the other thing that I would pick up from the book, and what it was such a pleasure to be part of, is that we have to put research at the heart of it, because actually research, in whichever way you define it, from social science through to biomedical and everything, engineering and everything else, is going to be part of the solution. But we must make that research relevant and available and accessible to all the communities in the world, not just those that can afford to pay for it. And finally, to finish, I think the book also offers some solutions and offers a sense of hope. And at the moment, with the current crisis and the crisis that we're likely to have to face in the 21st century, that message of hope, I think, is crucially important. Back to you.
Thank you very much. Thank you very much for ending on a message of hope and emphasizing the choices before us, which we definitely as scientists can pursue, and for raising the issue of inequality and poverty, inequality of the health crisis and of climate change. I turn now to Dr. Erminia Guarneri, who specializes in cardiovascular diseases. And she is a specialist in integrative medicine. Erminia, you have the floor.
Thank you. And thank you for the opportunity to be here, and to all the editors, Monsignor Sorondo, and of course our beloved Pope Francis, who I truly believe is a beacon of light during what feels to me like a time of darkness. I never thought as a cardiologist I would be presenting to such an esteemed group about an existential crisis as it relates to the healthcare system. Now, of course, climate change, ozone depletion, and everything that the book discusses, from biodiversity to air and water pollution, toxins, persistent organic pollutants, is in my exam room every day. As a cardiovascular specialist, and Dr. Neera just talked about air pollution claiming 7 million lives, many of that being through cardiovascular and respiratory illness. I live in a very affluent area of La Jolla, and even in this affluent area, we are seeing diseases that in medical school I never thought I would see, such as chikungunya, West Nile virus, and the likes, all of which are the result of the tropics moving northward, as we all well know. I believe that Dr. von Susteren's discussion on the mental impacts of climate change are critically important. Even with COVID-19 right now, what I am seeing in my practice is the request for antidepressants, sleeping pills, and the like, as well as the abuse of substances like alcohol and food in order to comfort people's anxiety and fear. Indigenous communities a long time ago taught us about the web of life, the relationship between the individual communities and our ecological health. And it's already been said that human health and environmental policies are not two separate issues. 90% of health is not accounted for by what happens in hospitals. It's not about hospitals. It's about social and environmental factors. And at least in the United States, I hope that we are awakening to the limitations of our current biomedical approach. And this is the focus we've taken in our section of the book, Jamie Harvard and I, to talk about how this biomedical model is not serving us anymore, and that how we need to move toward a more integrative, holistic model that really focuses on the root cause of health challenges and looks at all the global traditions. In this model, we need to truly shift our focus, if you might, from siloed medicine, ill to the pill thinking, treating people after they get sick, to a holistic model of health that embraces who we are in our social environment and the intimate relationship between people and planet. In short, as clinicians, we have to respect and recognize that what we do to the planet, we certainly do to ourselves. The global burden of chronic disease has precipitated a financial crisis in the healthcare sector, and this is very visible right now in the United States. COVID-19 has overwhelmed some of our best healthcare systems. New York City, known for some of the greatest healthcare in the world, revealed its fragility, its inability to function. More importantly, on some levels, COVID-19 woke us up and highlighted healthcare disparities. I really believe that this mechanistic model of healthcare is on the brink of collapse, and I think we are at a full-blown opportunity to look at how we can not only shift our thinking around climate change, but around our entire healthcare model. The healthcare sector, we have to remember, and we discussed this, has a sizable carbon footprint. We don't often think about that, but the UK, for example, National Health Service, says that approximately 35% of all public sector emissions comes from healthcare. And of that, 21% is the pharmaceutical industry. So if we have a healthcare system that focuses on just treating disease after it occurs, we just keep feeding this pharmaceutical system, which in turn continues to produce greenhouse gas emissions and to lead to illness, and we're not focusing on health. We've already discussed healthcare disparities, and they are prevalent across the globe, whether it's maternal mortality, infant mortality, the poorest communities are suffering. And I would go as far as to say that inequality and disparities are probably the largest influence we have today on the health of individuals, communities, and the planet. I believe that COVID-19 has taught us that our actions or our inactions are truly going to determine future human existence. And I hope when this question gets called to the table that we're answering it from a global and not a nationalistic perspective. Preventing the worst effects of climate change and the next pandemic go hand in hand. The more vulnerable a population is, the more ill a population is, the more vulnerable it is to diseases such as COVID-19. So the preparation for pandemics is about keeping people healthy at baseline, something which in the United States, I'm sorry to say, we've been unable to do. And that's across the world as well, as the global burden of disease tells us. Individuals with chronic diseases such as diabetes, hypertension, low-income communities, people of color are disproportionately affected by COVID-19 as they are disproportionately affected by climate change. We are less healthy at a huge, huge cost. So as a physician, I began to think about what does a new model of healthcare potentially look like, and how can we align ourselves and ground ourselves in climate justice principles. And I truly believe that the answer really lies in what the World Health Organization is calling for: a model of healthcare that focuses on traditional medicine strategies, a model of healthcare that focuses on disease prevention and health creation, as opposed to treating diseases after they occur. I really believe we need to catalyze a global shift to plant-based diets, and that we need to retrain our entire healthcare force. We cannot keep teaching clinicians ill to the pill medicine. We need a whole systems approach that focuses on health creation. We need to encourage every hospital across the globe to adapt climate neutrality goals and principles, or adopt the 2020 Healthcare Global Challenge. We need to take clinicians and organizations and encourage them to participate in movements like the Medical Society Consortium on Climate and Health. And clinicians need to stand behind politics, spiritual leaders, all behind equitable access to green spaces, advocate for affordable public transportation, restructure communities, as you've heard from Dr. Nira, for walking, for biking, practice good purchasing models, adopt zero waste principles, as we've done in small communities in India. And we need to just phase out things that are bad for our health, things, styrofoam, single-use plastics, and so on. So the current crisis is teaching us that we need to collaborate. If we become siloed, we will not be successful. We need to collaborate scientifically as global citizens, and we need to collaborate in communities. Actually, we need to take healthcare out of hospitals and bring it into communities and look at our entire health commons, and we must harness our collective wisdom. I believe that we are at a great time of change, and we have a great opportunity. With crisis comes opportunity, and the opportunity for us, certainly here in the United States, is to change the way we practice and do healthcare, and the opportunity for the world is to wake up and to bend the curve. And health is the common denominator. COVID-19 has taught us that it doesn't matter how much money you have in your bank account, you are vulnerable. A couple of years ago when Ebola hit, I heard people in La Jolla say, that's not about us, that's about Africa. Well, COVID-19 is teaching us that this is all about us, and we are all part of the web of life. So thank you for the opportunity to represent clinicians and talk about how climate change is right here in our waiting rooms. Thank you.
Thank you very much. Last not least in our speaker series, before our discussion session, I call on Dr. Conrado Estol, a health policy leader from Argentina, a neurologist. Dr. Conrado, you have the floor.
Good morning from Buenos Aires, from Argentina. And thank you to President von Braun, to Monsignor Ram, for the invitation to share the perspective from Latin America. We have discussed a lot about social justice already, and that has all to do with what happens and how pandemics affect Latin America. Let me give you a brief view of what the COVID-19 epidemic is now here, since our numbers are driving the whole numbers in the world. Those 100,000 new infected people per day are mostly from here, India and Russia also, but Mexico, Brazil, Peru are contributing with many. In Brazil, the problem with 1 million people now affected and almost 50,000 deaths, the problem has been of a lack of leadership. Actually, the favelas, which are slums, where you have 13 million people that cannot respect distance, that cannot avoid being concentrated, that cannot avoid close contact, are the crucial things to avoid contagiousness. And they also have a lot of mining and deforestation, which moves the virus from big cities to the interior of Brazil. In Peru, the problem is 1 out of 2 homes have a fridge. and 1 out of 3 homes have running water. So despite macroeconomics that look good, the people are really under poverty, and now you can see that with the ramping numbers they are showing. Ecuador, one city, Guayas. Guayas has 5 times the number of deaths of the normal time, which that's consistent with a war or famine. So only surpassed by Bergamo in Italy that had 6 times the death. And Chile, our neighbor, they are pretty different actually in Latin America in many aspects. However, they have large numbers of people affected, infected, and dead. And President Piñera said, we failed to isolate those infected and we failed to track the contacts. So what happened in Argentina? In Argentina, we do very low testing, and testing is crucial. So we really, the number of people that are infected that we see is probably 5-10 times less than we actually have. The same for the dead. We are only counting those with a positive test. So probably those numbers don't reflect, and the problem is low testing, the lowest for the region. We do 5,000 tests per million when Chile is doing 40,000 tests per million. Isolation, the lockdown is good. It was started early. In Latin America, we had a warning a few weeks in advance compared to the Northern Hemisphere. And our lockdown was on March 19th. However, now we are going into the longest quarantine in the world because the other things you should do to control the pandemic were not done. Number one, the testing. The mask was proposed by an independent physician, but not the ones that were advising the government. So the masks came a little late, and we know that they have a major effect. And this all reflects that we do not have the logistics in place. Our health system is not saturated yet. It's at 50%, but we don't have the logistics to organize what had to be done to control the pandemic. And that's why we are increasing the number of infected people every day, and we don't reach the peak, even though we are on day 90 of the lockdown. And I want to remind you that Wuhan did it in 76 days. So one of the questions I was sent is, how should we prepare for the health crisis related to climate in 2030? What do we learn? One thing we learn is that when it rains, we all get wet. And we are all in this together, as was said before. However, a pandemic exacerbates the vulnerability of societies like ours. And we do have a co-pandemic, because now we have COVID-19, and remember that a 60-year-old person in Latin America is biologically equivalent to a 75 or 80-year-old person in the Northern Hemisphere, because the load, the burden of disease, of non-communicable diseases, diabetes, hypertension, obesity, are much, much higher. That's why 85% of all vascular disease occurs in emerging regions. So the co-pandemic on COVID-19 and vascular disease is making that the toll in the Southern Hemisphere, especially in emerging regions, is much higher than in the Northern Hemisphere now. So for the future, and thinking of climate change, the decisions, the plans, the strategies should not be done country by country. We should do something together. The idea, the spirit of this book, something together for all countries to follow, like guidelines that are used to treat diseases based on evidence-based medicine. We should do the same thing for this. And then each country will adapt those guidelines, those worldwide guidelines, to the possibilities that the country has. I think that could be the best idea. Another question was, what are the lessons of COVID? The main lesson, I remember that Italian man for Lombardy who was asked, what would you do if this started again all over again? Well, I will obey. I will do what they told me to do. And what we should plan in advance. We have to plan in advance, but planning in advance in an emerging country or region is very difficult, because you can plan in advance and the plan be successful when you have a stable government, when you have strong institutions, when you have low poverty, when you have a growing economy, when you have low corruption. And unfortunately, those are not our strengths here. But I hope could be private-public partnership. That hasn't been explored for issues like this. It's not been explored for COVID-19. Now are independent efforts, but we should try and consider private-public partnerships. And again, the lesson of COVID-19 is we all depend on each other. It was clear with the masks. If I wear a mask, if I am sick, I'm not disseminating the virus to others. If I decarbonize, I am taking care of air pollution. I'm decreasing air pollution. And the most important lesson for Latin America, for emerging regions, is we have to strengthen our health system. I think in some countries, we cannot even call it a system. They are very weak, and we are seeing that now. The mortality rates are higher than in the Northern Hemisphere because our ICUs and the training of our physicians is not adequate. In general, the basics for Latin America and our countries is that we don't act like a unit. We cannot be considered as a unit. We are more than 20 countries in Latin America, but the ideologies, the governments are very different. Venezuela, Brazil, Chile, Ecuador, Argentina, very different ideologies, difficult to see them acting as a unit. Difficult sometimes to have one strategy in one country. Sometimes even that is difficult to achieve. And in most, Chile may be an exception, Uruguay may be, but in most, climate change is not an issue yet. So there is a reason why, because poverty is so rampant, as I mentioned before, that it cannibalizes the rest of the problems. So we don't have the time or the capacity to look at that. An example is the Mercosur. Mercosur is the union of Brazil, Argentina, Paraguay, and Uruguay, and it's been having conversations with the European Union for trading. But those conversations ended in 2019 after 20 years of negotiations. It took us 20 years to get together with others that could help us. And the problem is that the agreement barely acknowledges climate change. In fact, many of the trade arrangements are contrary to climate change. I will not help it, but we need the money, so we don't have the strength to do what we should do in that sense. So there was last week, there was an article in the New England Journal of Medicine by an independent group of particulate matter reviewers that were questioning the EPA standards of 12 micrograms per cubic meter of 2.5 particles as the level to avoid disease. So I'm mentioning this as the idea of all working together. In the United States, you have this independent group saying that there is clear evidence that 12 micrograms is wrong. It should be 8 to 10 maybe, or even low, if you want to protect the general population and the groups at risk especially. So again, the message is, if we are not together, nothing is going to happen, especially in our regions. We tend in general not to listen. We all know this TED Talk by Bill Gates 5 years ago, warning about a pandemic. President Obama also said something like that, and we didn't listen. Those talks were listened more now during the pandemic than when they were given a long time ago. Fauna, I remember, emphasizes in the book that injustice is not misfortune, it's a political act. So my hope is that I have confidence in that this book will raise awareness on the important problem of climate change and the health of the people, and maybe in the midst of this pandemic, even more so. Thank you.
Thank you very much, Dr. Conrado Estol, for this important and passionate plea. Colleagues, we have scheduled up to 30 minutes of discussion time. There were a few people who have volunteered themselves to take the floor during discussion time. And I would like to call on them in a moment. Before I do that, I would like to be particularly encouraging to the basic scientists, the academics who are doing science, basic science that could help us move forward with an agenda of planetary health and healthy people. I believe that basic science in health and in public health and basic science related to climate and ecology need to move closer together. Being an academy, colleagues, Academy of Science, forgive me that I want to give the debate at the beginning this twist towards science, and then come back to policy actions. We got excellent suggestions from many of our speakers on policy actions needed, but also ask ourselves what science action can we contribute? I would like to call in a moment on Andy Haynes, who had volunteered himself to talk about a new initiative in our field. May I encourage also you, Professor Ada Jonas, to take the floor in a moment, and maybe others. If you want to speak, I have a few people on the speakers list. Write your name simply in the commentary, in the so-called chat box. Then I see you and I will give you the floor. Keep your interventions brief. Andy, would you take the floor?
Well, thank you very much. And thanks again for giving me the opportunity to be involved in this landmark book. I think to me, it represents a book very much for the Anthropocene. And, you know, we have grown up in the Holocene epoch of 11,500 years when humanity transformed from being subsistence farmers, agriculturalists, and now urban dwellers. And we still think like Holocene dwellers, I think, and yet we're moving in, we're now in this new epoch, as we've heard, which poses completely different challenges to the past. And one of the great challenges, of course, is how to ensure the equitable health of the world's population within these finite planetary boundaries. I think we also now understand that we can't just talk about threats and catastrophes. That doesn't necessarily motivate people. We need to develop solutions. And I think, as you said in your introduction, those solutions cannot come from a single discipline. They can't come from science alone. So in reframing science and health for the Anthropocene, we need to step away from our traditional narrow perspectives, respecting different disciplinary, different faith perspectives, and work together towards common solutions. I think we've got an opportunity as well as a threat from COVID, so we can build back better from COVID, as some earlier speakers have said. We do have this brief opportunity to implement zero carbon and other more sustainable policies. And we also see how a range of professions, including the health professions, are becoming mobilized on a global scale. So in an unprecedented step, the representatives of 40 million health professionals wrote to the heads of governments of the G20 nations and asked them to ensure that when we emerged from COVID, it was on a low carbon and sustainable trajectory. Whether those heads of state will listen to that, I don't know, but it's very important that the health professionals were standing together and making that statement in a way I don't think they would have done even a few years ago. And that's thanks to WHO and some of the other leaders of the health professionals. So we need to build on this new insights, this transdisciplinary collaboration in order to create solutions. And very briefly, I just wanted to mention this new initiative, this new commission that we hope to launch over coming months with the support of the Wellcome Trust, building on some of the work we did for the Planetary Health Commission a few years ago. And what this commission is going to do is very much to focus on solutions, learning from each other. And it isn't just about theoretical solutions, it's also about people implementing new ways of doing things around the world, decarbonizing energy systems, moving towards more sustainable food systems, increased plant food diets, less dependence on animal products, sustainable cities, which are both more resilient to environmental change, but also have lower environmental footprints, transport systems which promote active travel and reduce air pollution, and healthcare systems which, as we've already heard, do not contribute to ill health, but reduce their environmental footprint, provide more care in the community, and depend less on high-tech hospital care where that's not appropriate. So the idea of this initiative is very much to harness the insights and the understanding from a range of different disciplines, populations, indigenous communities around the world, to try to tap the best thinking about potential solutions that will help us on a pathway through the Anthropocene that will sustain the health of humanity within these planetary boundaries. So our task now is to ensure that this book is really a catalyst for transformative change. And I think we all have a role to play in that. Thank you very much.
Well, thank you very much. Let me turn to two colleagues who had signaled early before the meeting, actually, that they would like to speak. Congressman Scott Peters, you were at the conference in the Vatican. And please take the floor and tell us what should next happen in the domain we are addressing here.
Well, thank you very much. It's been such a pleasure and an honor to be part of this whole project. And I'm just humbled to be in the company of such great scientists motivated for such good things. Two observations. One is we're trying to use the pandemic to explain that the warning about climate change is real. And what we saw in the pandemic was scientists warning that this would happen. And indeed it did happen. That it was did not respect international boundaries. It was something that happened worldwide. And we also learned that it would have been much cheaper to deal with it up front than waiting to deal with it in reaction. Those are all lessons that we can apply to climate change and to sort of to get policymakers to take it more seriously now in the midst of all these crises that take up our attention in the moment. Second, I would just offer a little bit of optimism about the country. In the United States, we're in the middle of a political crisis as well as health crisis and an economic crisis. But I think across the board, the public has been expressing their concern about climate change at the ballot box. For the first time in 2018, since the conference, we saw that voters in Republican districts were expressing a concern about this. It's somewhat generational, but it's also been picked up by members of Congress. And even the most skeptical and recalcitrant folks have tried to pick up some portfolio about climate. So I think that we have a lot of work to do, but I think there is progress. And I would just say that the policy has to be driven by science. And I hope as you see policy develop that you'll be part of a feedback loop about what works best and what is what fundamentally has to happen, because we'll need your good thinking and your encouragement along the way. But again, congratulations to everyone. Thank you very much for including me. Dr. Rahm and Governor Brown, very good to see you both. And I will yield back with great thanks.
Thank you so much. It's encouraging that you continue to engage with us, and please do so also in the future with the Pontifical Academy of Science in fields of science policy and environmental and people sustainability. Let me call on Dorwood Selke, please.
Thank you. Likewise, I'm very pleased to be here and to be part of this book. We've heard that climate and health are the greatest moral challenge. We know also that climate represents the greatest market failure in the history of the world. And we should know that the failure to solve climate change will represent the biggest risk to social justice, especially if we fail to solve climate change in time. Speed must become one of our newest metrics, the need for speed. We understand that we have between 0 and 10 years before the feedback systems in the climate take over climate and the earth will warm itself. We'll start passing tipping points that lead to irreparable harm that we will never recover from. Now, we know that we can move fast with the super pollutants. That's the topic of the chapter I did with Ramanathan and others. And the super pollutants, which Congressman Peters also focuses on with his legislation, are the air pollutants, black carbon, tropospheric ozone, methane, plus the HFC refrigerants. And we know that we have the technology and often the legal systems that will allow us to reduce these pollutants fast. And if we do that, we can cut the rate of global warming in half and the rate of Arctic warming, which is critical, by 2/3. And we've read about the Siberian heat wave right now. Very frightening to see what's going on in that part of the world. So the super pollutants we can think about as the fastest runners in a relay race that can keep us in this race until we get to carbon neutrality at 2050. And listening to the presentation today and having read pieces of the book, what the book is doing, I think, is helping us learn how to talk about climate in a much more effective way to help make this into a kitchen table issue that families can sit around the table and talk about and understand. They can understand the health risks, and the health risks are leading us to the climate risk and the health risk with climate. And this is leading to deeper understanding and to feelings that accelerate and build our intensity, the kind of intensity that we need to act. That's ultimately what this book is doing. It's inspiring us to act and giving us a roadmap in many cases as well. So the inspiration to act is in politics, as Congressman Peter mentioned, in commerce, in our own behavior, and it's helping us strengthen our core morality, something that we need to sustain the action to ultimately solve the climate crisis. Thank you.
Thank you very much. Professor Ada Jonat, may I call on you for a moment? You can, of course, decline my request, but you are into basic science, antibiotics. Give us a perspective from your side. If you unmute yourself, we are eager to listen to you.
Good afternoon.
Yes.
I will never have the guts to decline your offer. You are the boss.
No,
So,
a humble follower.
Thanks for inviting me. I was really very happy to hear some Bible here in the beginning, not only science, not only human health and human existing, also about Cain and Abel. So if I may start, I'm a scientist, but I don't work on climate change. And actually, I have very little to say about it. I just want to remind you that even in the Bible, there were big storms. I'm sure you all heard about Noah's Ark, that they had to fled with all the animals, and was found at the end at the top of a mountain, couldn't even go down until the water were disappeared or were down anyway. So with this, I wanted to say directly or indirectly that storms and changes and climate changes have been. I don't know if in the magnitude that it's now, I have nothing to compare to. Now there are lots of measurements and some of them are very convincing, but it's not my field. So I want to skip climate change and separate it from a very important issue, which is keeping our world clean. And clean, I mean clean from all points of view, not only taking dirt off, but also stopping polluting. And from this point of view, I have something very little to say, and this is the resistance to antibiotics. So antibiotics, when they came into use in the middle of last century, they made a revolution. People died before this at the age of 50 a 50, 60 was considered very old, and people died from simple infections. Let's just talk about one person, Mozart. He died 36 years old from an infection, and many others, Schubert, Kafka, and many others. I'm not going to say all the names now. When antibiotics came, they could get rid of infections, and infections. Some of them are very, very powerful. Now everybody talks about COVID-19. COVID-19 will disappear, and infections will unfortunately stay. Viruses are smaller than bacteria. Bacteria cause infections. They are much smaller and, in my opinion, much more clever, but they don't last very long. Whereas the bacteria, the infectious bacteria, the pathogens, they exist for hundreds of years. And if you just want to hear what the World Health Association said recently, this is the biggest problem that we have now in medicine, even bigger than cancer or diseases like this, because at least a third of the people that have cancer, that are hospitalized for cancer, and then die for an infectious disease, which is simple, like pneumonia. And in the United States, there were 13 million deaths in the last 3 years from infectious diseases. In Europe, each year 30,000 deaths, and I don't talk about long diseases. The reason is that these very powerful materials, the antibiotics, became much less useful because the bacteria developed resistance to them. And I'm sure you all know about it. I don't have to tell you that resistance is difficult, it's a big problem, and so on. But from the scientific point of view, I'm afraid that it won't be so simple to get rid of them or to overcome. I'm doing all my best to do it. That's my biggest contribution to science now. But companies do nothing at all. Or I don't want to say nothing at all, very little, because antibiotics are not profitable, because there will be resistance, and because the developing time is very long, and they have to attract investors that want to see fast income. So this is a problem. And from the point of view of pollution, most of the antibiotics that are being used in our days, and sometimes overused, but I don't want to blame anybody, let's say being used, most of them contain a little piece, a little core that is not degradable, not biodegradable. So even if there is not overuse, just taking the antibiotics as it's prescribed, and even recovering, the piece, the core, the component that was not biodegradable, it was not digestible, is coming out to the sewage. And because it's not biodegradable, it goes with the sewage. And because it's so small, most of the purification systems don't see them, don't catch them. So they go back to the irrigation system. And then we get them back when we eat the fruit, or the cows eat the grass, and we get the milk. So we get back these pieces to us, but not only to us, the world is much more polluted. So this is a problem that disturbs at least me. I hope it disturbs, I hope that it will disturb many more, so there will be more activity around it. But that's what we are trying to do, to produce antibiotics that are degradable and they are specific and so on and so on. I don't want to talk about this, but I want to tell you that the World Health Association, the European community, the American government, and consequently the Japanese, I think also the German as a government, but at least as part of the European community and of the G20, they all came out now with a lot of money, or what they call a lot of money, maybe not enough, for research on antibiotics. But so far, these governments and these big organizations could not convince the companies. And I think that we are at the edge here. This is my biggest problem, and thank you for telling it, for letting me tell it.
Thank you so much. Colleagues, we have about 8 minutes left. There are 6 people who have mentioned that they could speak.
Sorry.
No, don't.
I apologize.
It was great to listen to you, Ada. It was great to listen to you. So I ask you to speak in sound bites and to look for the next opportunity when we meet again in Casina PO4. Mohammed Hassan, we need a perspective from Africa and science. Unmute yourself. Your microphone is muted. While you are looking for it, Vandalai Bagnato.
Yeah. Hello. Can you hear me now?
You. Yes, yes. Go ahead.
All right. Well, hi. Good afternoon, Joachim, and thank you very much. You wanted me to say something about the reflections from the African side on these issues. As we all know, Joachim, Africa is the continent with the least capacity to adapt to climate change, to combat air pollution and diseases. But at the same time, Africa has the least capacity in science, technology, and innovation that it badly needs to address problems related to these issues. But as we all know, if you want to build capacities to a level that will enable you to address and solve problems, you need to invest in science, technology, and innovation. And this is really the core of the problems. Because there is very little money that African countries spend in research and development. And one can ask, yeah, these countries are poor, they can't find the money to do that, but this is not altogether true. Because if you look at government expenditure in all sectors, and you try to see how African governments spend their money, you find a very disturbing picture. And this is something recent that I have been looking at. Africa spends a lot of money in the military and in the security. As a percentage of GDP, if you look at the investment in the military across the entire world, you will find that the top 15 countries, I'm talking about expenditure as a percentage of GDP, the top 15 countries are developing countries. And among these 15 countries, 8 of them are in Africa. And what really disturbed us most here in Sudan is that the top of the list is my country, Sudan. And that was the data 2 years ago. So when we presented this data to the government, they were absolutely astonished and shocked. So fortunately, just a few months ago, the government decided to substantially reduce its expenditure in the military and to invest more in health and in education. So I think one would like to see this being applied across the continent. But it is an issue that I think all of us should really bring to the notice of governments everywhere we look at that. The last problem that I think we are faced with at the moment is the impact of COVID-19 on quality education. And as whether we like it or not, COVID-19 is going to transform the way education is carried out or is delivered. This is really going to be a complete transformation, and it is going to be based on using online platforms, using information technologies, digitization, and so on. And for this, Africa really needs to build these capacities in communication and in digitization technologies to enable it to address these issues of education. Otherwise, the gap in quality education between Africa will be enormous. Thank you.
Thank you very much. It's difficult to ask scientists to talk in sound bites, I know. I have, Vanderlei, you have fascinating science. Can you do a sound bite?
Well, first of all, I want to congratulate the Academy to, again, post itself as one of the important players on this issue of climate change and healthcare in general. And I was in this meeting as an observer, and I think we thought that we had a huge problem on climate change, that we are sure. Now we have another huge problem that we knew exist, we were not paying attention, which are the microbiological control. They both very important. I believe that this pandemic will pass, will come back. I'm not sure that we'll be able to control the climate change problem. So this is even a big issue. In Brazil, Von Braun, this pandemic, as I already was put the numbers, I'm not gonna repeat for the lack of time. One thing is positive. Science is responding very well. We are producing equipment that we never thought we were able to. We are producing medication that we never thought we would be able to. And of course, people say, well, in Brazil is a big problem. Everywhere is a big problem. Nobody was prepared for this situation, right? And the science is responding well. My laboratory did not stop. We are fully developing techniques for treating people with respiratory disease as a consequence or as a cause of the COVID, and things are going well. We are doing many devices in controlling microbiological in the environment to avoid infection. Many companies are involved in the project. We have now a pool of 26 companies that are producing things that are necessary for helping with the situation. So to be brief, I think our colleague from Argentina, Conrado, he's right. Latin America has some political problems, but the science in Latin America is responding very well, trying to do everything we can to help this dramatic situation. And again, I want to congratulate for this piece of reference on climate change. And I'm sure that all the libraries and everybody will help to diffuse the large quantity of information we have there. Thank you very much.
Thank you. Thank you. Helena Valdez.
Thanks. Thank you very quickly from my end. It's not about science that I'm going to speak. I'm just going to, again, congratulate you and offer a platform, which is the Climate and Clean Air Coalition, where we have now 70 countries involved, and they would love to hear from you because we are a science-based coalition trying to address the issue of speed, as Durwood mentioned, to address the super pollutants, the short-lived climate pollutants, but in a very integrated way. So number one, want to offer this platform and see how the findings and the 12 solutions can reach the decision makers. And the second point I wanted to mention is what I also think could be added maybe for a next iteration of this is looking at how we value this building back better and to achieve this not only based on economic growth, because I think it's an issue that is too little spoken about, and it's not about science only, obviously, but it's a very much a value proposition that many people in between South and North and also within individual countries is not sufficiently worked upon. On the third point, I wanted to pick up on Africa because we are right now working on a regional integrated assessment on air pollution for Africa. And I would like to offer any of the authors in this book, if you're interested to join this very big effort to share with more African scientists how this type of reflection could be brought like from a bottom-up perspective in Africa. So those 3 points, and I really look forward to see what we can do with this and how we can get the speed and the finance flowing to this kind of urgency issues together. So thank you.
Thank you. Fauna Foreman.
Thank you so much. Just as much of a soundbite as I can. As we talk about—
Speak up, you're too low voice, louder.
There we go. Is it okay? Yeah. Okay.
Good.
As much of a soundbite as I can, as we talk about mobilizing urgent solutions right now. And, you know, the health narrative is essential to that, to creating kitchen table conversations, as Durwood said. We also need to be thinking about adaptation urgently in the meantime. So, you know, there's you know, the impacts on the poor are part of an injustice, not a misfortune. And so part of our global responsibility is to mobilize resources as quickly as we can to help the bottom up adapt. So solutions are not just top down right now, they need to be mobilized from the bottom up. And hopefully this book can play a role in communicating that. Thank you.
Wonderful. Thank you. Richard Miller. Then, if not there, I ask Peter Raven. Peter? And thereafter, I will ask you, Ram, to say a few closing words before I close. Peter?
Basically, I wanted to state that background indicates that only the kind of love, charity, and social justice that Pope Francis preaches so effectively will allow any of this to happen. We live in a world where we're destroying our ecosystems and driving our species to extinction that are making those ecosystems function. The rich countries of the world are using basically 3 to 4 times what they produce, and Global Footprint Network points out very clearly the differences between nations in this respect and demonstrates very little real desire or willingness to share. 8 people in the world control as much wealth as the 3.6 billion poorest people in the world, while 1 billion people are living deprived lives of hunger. Overcoming that in some way, making the rich nations care instead of sweeping wealth out of all the poorer ones, in a finite world, again, see Global Footprint Network is the only thing that will allow us to survive over the long run. Pope Francis is exactly right. We don't have enough love, charity, and appreciation for one another to make any of this work. It can never work in individual countries or by individuals. Our historical selfishness will overcome it. Please find it in your hearts to spread the gospel of Pope Francis and figure out broader ways to bring nations together for the solution of these incredibly important problems.
Thank you. Ram, of our meeting, would you like to take the floor before I close, Ram?
Thank you, Joachim. It's an honor to add to what has been said already. I'm going to be working with my colleagues in the Pontifical Academy of Science, particularly our president, Joachim, and Marcelo. And where do we go next? How can the Pontifical Academy help in this existential threat? So if you have any ideas, we would like to see, what we'd like to discuss, and how we can help this global issue, please feel free to email me and share with me with your ideas. I want to thank Marcelo and Joachim for putting on this fantastic event. Thank you.
Well, thank you. Let me close with 3 points. A lot more needs to be done. My first point is science in health and climate and ecology science need to move closer together on the way forward. That's what we as scientists can do. My second point is this is the moment to see the poor, as Pope Francis says. This is the moment to see the poor. The moment defined from the climate threat and from the pandemic threat and from the ecology threats. So it's not generalities, but the focus on the poor and on inequality, which needs to move us forward in the policy agenda. I'm very pleased that you, Congressman Peters, are still with us here. And I know that this is also in line with your thinking. And it was emphasized by Cardinal Turkson, the moment to see the poor and the inequality issues. Third and last, cooperation. Our cooperation has to be global, transnational, not national, transnational. The conclusion which you, Ram, read at the outset in your speech, the conclusion number 12 of our commandments in that book, was to promote an alliance with society that brings together scientists, policymakers, healthcare providers, faith and spiritual leaders, communities, and foundations to foster the societal transformation necessary to achieve our goals in the spirit of Pope Francis' encyclical Laudato Si. So the alliance building, which we as scientists need to be part of, and maybe we can also be drivers of it. I would like to close by thanking His Eminence, Cardinal Peter Turkson, that he kicked us off on integral ecology, and which was the red thread running through our dialogue today. Ending, I would like to ask you, Marcelo, if you would like to have a closing thought. Marcelo, you will close this meeting.
I want to thank all the people to participate, very active, and a very wisdom and intelligent contributions. And God bless you and your work, just to follow these ideas that are very central for the sake of the people and the planet. Thank you very much. Thank you, President, also for your chairman. That was very good.
Thank you all.